So the next thing we were going to talk about, you abbreviated it in your email to me, PRP. So that's like the vampire facials. And I know I had a couple questions come through about that. So want to just tell me about that and what PRP means?
Absolutely. So PRP stands for platelet-rich plasma. And basically it is drawn from your body, and we spin the blood down, and we basically take the plasma or the platelets from that blood that's spun down, and we apply it to various parts of the body. So Vampire is a trademark. Dr. Runnels invented the procedures, and we are part of that organization. He offers great training and really good science behind the procedures. So we decided, that's what we want to be a part of. And so there's some different applications that we do with it. And I'll show you, most people have seen this around on the internet. Those that have watched, Kim Kardashian, she had the vampire facial. The vampire facial is where you take your own plasma and basically have it microneedled back into your face. Very effective for fine lines, acne scars, some pigmentations. You're numbed up beforehand. That sits on your skin for about 30 minutes. And while you're numbing up, that's when we draw your blood. And then we process the blood, and then it's injected, microneedled back into the face. Now there's another procedure called the facelift. The vampire facelift involves injecting that PRP a little bit deeper into the skin, in addition to a dermal filler such as Juvederm or Voluma is used as well. And that the dermal filler acts like a seed, and then the PRP is the fertilizer that helps build collagen and add volume to the face and help with fine lines and wrinkles. So what your platelets do, they contain growth factors, and it will stimulate collagen production, blood vessels that will improve the vasculature, the color, the blood flow to the area. And people like this is because it's natural. It's using their own healing products of the blood to be injected back into the skin. So that's the facelift. The needle that we use is injected a little bit deeper past the dermis than what you get with microneedling. So a little bit more is involved with that. Downtime with that, both of the procedures is a couple days. You'll leave out of here a little bit red and swollen. And sometimes bruised, depending on the person. Bruising can occur as well, but it gives a tremendous glow to the skin. One of my favorite things to do, because the end result is amazing.
So what are some things that the vampire facial treats? Does it treat discoloration, acne? Like, what is its main?
Yes, all of the above. Because it's got, anti-inflammatory properties, a lot of healing properties to it. It'll treat fine lines and wrinkles. It'll treat some acne scarring. If you have active acne, we don't inject in that area. We got to wait till it calms down.
Okay.
But pigmentation, it kind of treats a little bit of everything.
That's awesome. And how often do you need to do that once you get it done?
So highly individualized, depending on the degree of wrinkles that you might be treating or pigmentation. And of course, with the microneedling, the facial, that one may require, 3 to 4 treatments to get a maximum effect from that. And whereas the facelift, you might need to do twice a year, but highly depends on your individual when they come in and what we're trying to treat.
Awesome. So if someone wanted to do that before a special occasion, how far in advance would they want to do that?
Again, a good month. Okay. And if they're doing, say, the facelift, I would give it, maybe even a couple months.
Okay. So to let that swelling and all the benefits come down.
Yep. And let those take effect and have that collagen be formed. I would say a good 8 weeks.
Okay. Yeah. And how much does that run? The facial? That was a question that came through.
Perfect. So each one is different. The facial is the least expensive. These prices are set by the Vampire trademark. Dr. Runnels sets the prices, and it starts at 600, and then the treatments go on up. We do hair restoration with it as well, and those can go on upwards of $1,800, $2,000. And I would say the most important thing to take away is that here soon, once everything is lifted and this virus is behind us, we'll be running some specials. We cannot advertise prices less than what they set out, but we'll be running some specials where, we'll say 20% off. And then at that point in time, I'd say call us and get scheduled.
That's awesome. I'm so excited to see some results from those.
I had both a facial and a facelift in February. I went to the training, and I felt like the results were amazing.
Oh yeah, your face and skin looks awesome. So that's awesome.
It was very well worth it. And I'm not one I had never really taken good care of my skin, and not one to do all the preventive stuff that I should have done. I wished I would have, but the Vampire facelift was amazing.
Yeah. And is it pretty uncomfortable?
We used the topical numbing cream again, and honestly, it was, I would say on a scale from 1 to 10, it was probably a 2 or 3. And the only area that I really felt when I got the micro needling was the hairline. And I think it's just because they didn't put the numbing cream up high enough.
Okay.
So that was the only tender area. Now, when you inject the PRP a little bit deeper into the face, you can have about 30 seconds where it feels a little bit uncomfortable, but then it's very brief and then you're done. So
another question that came through was about tear trough filler.
Yes.
And this did come from a younger gal who was getting married, and she was wondering how long it lasts. And I think she also maybe wondered what it cost, but I can't remember now if she asked that. She definitely asked how long it lasts.
So in the tear troughs, there's tear troughs that'll form with aging, and there are tear troughs that are more congenital. And the congenital tear troughs you'll see in people young, but under the age of 18, and you can feel both of those. However, you use a little bit different technique when it comes to those that you develop with aging. I like to use Volbella because it's a very pliable and forgiving product, and it won't create the overfilling that you can get. We don't like to use Juvederm because it is hydrophilic, and that means that water is going to be absorbed into that, and you can overtreat those areas. So I like to use Volbella, and basically that product runs, depending on how much you need. A half a syringe starts at 400, a full syringe is around 700, I believe.
Okay. And how far in advance? Is that the same kind of a month out from your wedding that you'd want to do that?
Yep, definitely.
Okay. And could you get some bruising? Is it the same kind of?
Yep, same potential complications. And so, doing like 6 weeks out 6 to 8 weeks would be even better, because then you can make sure, if we need to do touch-ups, we can. But yeah, it's a good 4 weeks minimum.
Mm-hmm. Awesome. I will let her know that, or direct her to the studio.